Did you know that false positive blood cultures continue to be a source of frustration for clinical and laboratory workers across the country? These contamination events can tack on thousands of dollars in additional healthcare costs and create adverse outcomes due to unnecessary admission to the hospital, increased length of stay, unwarranted antibiotic use, treatment side effects, and increased risk for antimicrobial resistance. In its 2022 Principles and Procedures for Blood Cultures, the Clinical and Laboratory Standards Institute, CLSI, stated that laboratories are expected to achieve blood culture contamination rates substantially lower than 3%, with an ultimate target contamination rate of 1% when best practices are followed. That means that an institution that does 5,000 blood draws a year is expected to have no more than 50 contamination events a year. Although blood culture bottles come with a protective cap, the septum of the bottle is not sterile. It is now standard of practice to disinfect the tops of blood culture collection bottles prior to use. It is well known that the rubber stoppers of blood culture bottles are not sterile, nor does the dust cover cap protect them from contamination. Studies show that there is a significantly lower rate of blood culture contamination in hospitals where an antiseptic was applied to the tops of blood culture collection bottles prior to use. A quality improvement initiative in a neonatal care unit demonstrated that including this intervention led to an overall blood culture contamination rate decrease from 2% during the baseline period to 0.9% after implementation. Did you know that PDI's Prevantics 3.15% chlorhexidine gluconate and 70% isopropyl alcohol device swab is indicated for use on blood culture bottle tops? The Prevantics Device Swab is not only indicated for the disinfection of needleless access sites prior to use, but also for the disinfection of blood culture bottle tops prior to access. Prepping the bottle tops is easy. Step 1. Simply remove the cap of the blood culture bottle. Step 2. Look for the words "Tear below" found on the back side of the packet and tear downward and diagonal to retrieve the swab. Step 3. Do not unfold the swab. Step 4. Prior to access, apply the swab to the top and septum of the blood culture collection bottle by holding the swab between your thumb and index finger, and scrub using repeated back and forth strokes for 5 seconds. Step 5. Allow to air dry for 5 seconds. Step 6. Discard after single use. If you are disinfecting an additional bottle, use a new swab and repeat the previous steps. Help lower your blood culture contamination rates today with PDI's Prevantics Device Swab.